would like to play a video which I have made just to show how psychiatry has evolved. Can we play a video? So this was just a short video, just for 4 minutes, to highlight how psychiatry has evolved. The message is simple one, and that is stigma. Stigma still is prevalent. The paper which I am going to present next is on stigma, and it is stigma related to the field of psychiatry. So the basic research which I did in 2020 is basically adopted or taken from the research of Dr. Anam Haider. She is an assistant, I think she's now associate professor in the Department of Psychiatry Civil Hospital. So she did a research on medical students, but she involved the students only from one medical college, that is Dow University of Health Sciences or Dow Medical College. So I wanted to understand the difference between different medical colleges and their attitudes towards the field of psychiatry, because in my opinion, the best, it is not now which you are thinking. The problem is that when we think of psychiatry and psychiatrists, we generally understand that the field has many things which are just myths. And these are basically the concepts from our society. No doubt man lives in a society, but it is the society or the culture that creates these stigmas or myths revolving the field of psychiatry. So I thought, okay, why this is happening, that the field of psychiatry is not as promoted as other branches. Why students are not as interested in this field as in field of medicine, surgery, and so on. So I did a research, and now I'm going to present a research. It's a little research. So it involves the study from 6 medical colleges of Sindh. The medical colleges are Dow, JSMU, Hamdard Medical College, Khairpur Medical College, Chandka Medical College, and Ziauddin University. I tried to survey or to give, I tried my best to give this form which I developed to Aga Khan students, but unfortunately I could not get response, so I omitted that. So let's move. So I will not go in detail what Goffman in 1963 has said. I will just go on. So this is simply the definition would go on my research. So as I said, man lives in a society, but the problem is again the society which creates a stigma and myths, and then we are part of it. The stigma which is part basically of society, it then transfers to parents who basically decide what a child or a student has to do in future. Then the parents, of course, ask the students or their sons or their daughters not to choose this field because of the stigma. So what is the role of health professionals other than psychiatrists? I have observed and have also got results from various studies that the professionals other than the psychiatrists like pediatricians, surgeons and others, they do not hold the view of psychiatrists as good as it should be. So the role is of course not as good. And because of this concept, this knowledge is basically transferred to the medical students. And the medical students, then even when they don't know how this field is going on, they don't think of choosing this field. So there are various orthodox views about the psychiatry. Pediatricians think doctors think that pediatricians have a friendly smile. Surgeons keep dynamic personality. And the psychiatrists have their own appearance, sometimes good, sometimes bad, sometimes awkward, whatever. So as I said, this affects the minds of students. So the again problem is this subject is not taught as an independent subject. This is in final year only a part of medicine paper. Just 10 questions are given to students, and then a student very rarely just tries to study. In medicine, I think Davidson book, there's a chapter of psychiatry, and then they just go through it and they don't realize what this field is. So as I said, the study which was basically I adopted was from Dr. Anam Haider. So this was done in Dow. So I tried to include all the medical colleges of Sindh, not urban but rural areas also. So it's a cross-sectional study. The study had 2 parts, the demographics and then scale this. This scale is a good scale, and this only can be adopted when you get permission of the author. So I got permission and then did this study. And since the study was on students, so all other were excluded. So what was the result? So 512 medical students were registered, and which now we are going to understand 65% of students said they learn psychiatry because it is a part of exam. And 60% students say the mentally ill persons can never recur enough to live a qualitative life, and this is a myth. The severe psychiatric illness are very low, just 4%, as Dr. Saeed Farooq just said, and the prevalence of schizophrenia is just 1%. So only those cases we don't know, but they can also lead a qualitative life too. 62% of students think psychiatric patients are violent. 46% students think that being a psychiatrist is not like being a real doctor. 46.9% students think that being a psychiatrist is not like being a genuine doctor. The scale which I told you was the Mika scale. The Mika scale has 16 questions and is a Likert scale. So there are options agree or disagree, and these are the ratings. So when the lowest score is 16 and the highest is 96. So what we got is the mean score was 54.2, and the score from Dow University, it was 41.06. And from Hamdard College of Medicine and Dentistry, it had high Mika score. So this Mika score, basically, the lower the score, the higher is the stigma. So lower the score, lower is the stigma, sorry. And the Dow University had a better knowledge about the field of psychiatry rather than students from other colleges. I have not mentioned here Chandka Medical College because I am from Chandka Medical College, and also Khairpur Medical College where Haresh is from, and the results were same. The results were, of course, close to Hamdard College of Medicine and Dentistry. So when we compared this to international studies, we found that the international studies hold lower scores than our study. Our score was 54.2 and their score was less. So it means their students had a better knowledge about the field rather than our students. But there was another state, which is, there was a state, Georgia, where they had a higher score. But when I saw the study itself was biased and wrong. And so I omitted also that could not be applied here because this is a different type of study. When I thought why the students from Dow and Hamdard had a lower school, then I thought it must be because those students are basically coming from the system. They are mostly from Karachi or other provinces also, but their education system is not following the Sindh textbook board or Punjab textbook board, where psychology is not a subject. The subject of psychology is basically taught in O or A levels, so that's why they have better knowledge about this field. And when I also talk to students from Dow or SMC, they have knowledge about psychiatry. But when I talk to students from other colleges, they don't have. So this can be the reason. What is the reason why I did a study was wanted to know why this happens. So, of course, we can't change the curriculum of a Sindh textbook board. We can ask the government to change that, but we can also ask our colleagues, our universities, our policy makers to include psychiatry as a separate subject like medicine, pediatrics, and so on. This is all about my study. Thank you.